Hi, my name is Rhonda Ferguson. I work as an RPN at a long-term facility here in Athens. I've been asked to speak to you about the human-to-human relationship and the theory behind that and how it relates to my place of employment. The sympathy phase is what I understand brings out the need to assist your patients and what you need to do for them. This kind of relates to like wanting to help out the individual who's struggling post a stroke and how they're striving to maintain and bring back their mobility. As a nurse and practicing it for the last 15 years, you have to be really careful with this phase and the way that it was explained. Sympathy sometimes can relate back to wanting to do it for you. And in reality, you want to take a step back, and yes, they're struggling, but how do we actually get them back to doing it themselves, maintaining what they already have, and trying to get that mobility back to a point where they can do it for themselves. It's really easy to direct your sympathy back to yourself when in reality you have to put it back to your patient or your client and make sure that they're doing the best that they possibly can. The rapport stage, by the sounds of it, is the trusting stage that you would have, and it's the most fundamental relationship you want to have with your client or your patient or your resident. And sometimes, especially in the older generation, like what I deal with every day, it's a natural expected thing as a nurse or a healthcare provider. It's something that is instilled in them. They trust them regardless of what has happened in the past. I've heard it time and time again that it's the doctor said it, that's okay. You told me that I can do it, that's okay. It's picking up on the body language, especially now that in our generation or in our clientele that it's starting to change from just that generation, the senior citizens. It's anything over 20 now is now being admitted to a long-term facility. So building up a rapport with your new individuals or your younger individuals, it's a little bit more difficult. Picking up on body language and subtle facial expressions can assist you as a nurse, to achieve this stage. It's important, a lesson to learn is that not all nurses can achieve this stage with every client or every patient. Sometimes I have had it like an example of one of our PSWs can't look after an individual because she reminds her of a teacher that used to give her the strap when she was a child. Obviously, they will never have that client relationship or that rapport stage because she thinks her teacher, she's going to get the strap. So in that sense, just make sure they're cared for, and maybe somebody else can have that rapport stage, and if when possible, make sure that that's part of your recognizing your relationship with that individual too. It's okay to pass it off if that's able to do so. Hope that helps.